My name is Tom. I'm a student nurse, and I'm just going to be demonstrating how to administer medication via IV through a Minibag. So I see here that I have a patient. Her name is Dabna Dory, or Dory Dabney. She was born on October 3rd, 1996. 3 days ago, she was scratched by a cat on her left arm. Her left arm has been getting increasingly sore, red, and warm. She has been admitted with cellulitis of the left arm. So I see here that Dory is allergic to morphine, and I see that the physician has ordered cloxacillin for her cellulitis infection on her left arm. So I can go ahead and, prior to this, I already compared the MAR to the physician's order, and it has been properly transcribed. So I can go ahead and do my first check. I had already drawn out cloxacillin from the Pyxis machine. So now I can do my first check. So cloxacillin, correct medication. This is for Dora Dabney, correct patient. I need 1 gram of cloxacillin. There's 2,000 grams in this vial, so I have enough medication. Should be given intravenously. This is meant for IV use. Should be given every 6 hours, and it's scheduled for now. Time is now, so correct time and frequency. So now I'm just going to take a peek at the PDM here. I see that cloxacillin is an antibiotic, and that makes sense because it will be used to treat an infection on her left arm. It can be administered by a student nurse, which I am, so I can proceed. The usual dosage is 1 to 2 grams via IV every 4 to 6 hours, and I see here I'm ordered 1 gram for every 6 hours, so that lies within these parameters. And it's under the max daily dose of 2 grams, so I can proceed administering this order. It should be diluted in 50 to 100 milliliters of normal saline. I have 100 milliliters of normal saline here, and it should be administered over 30 to 60 minutes. I also note that it is compatible with normal saline, which she has running at 25 milliliters an hour already. That's her primary infusion right now. So now I can go ahead and begin to prepare the medication. So I perform hand hygiene. I would swab the top for 30 seconds, let dry for 15. I'm not going to do it for that long for the sake of the demo. And I would do the same for sterile water here. I need to reconstitute this medication with 6.8 milliliters of sterile water according to the PDM. So I'm also going to sanitize or alcohol swab the top of this for 30 and let dry for 15. So now I'm going to grab my syringe here and a blunt fill. Wing these back, and without contaminating the tip here, just apply. Won't be needing these anymore. So I'll be drawing up 6.8 milliliters of sterile water. So I'm going to draw out 6.8 milliliters of air and inject it into the vial here just to maintain that vacuum system in the vials. And so I'll draw out 6.8 milliliters and tap out all the bubbles here. Perfect.
So now I'm going to check the IV site.
And recalibrate to 6.8. So I have 6.8 milliliters of sterile water here. Without any bubbles, and I'm going to inject that into the cloxacillin here and mix, and then draw out 6.8 or roughly 6.8 milliliters of air to maintain that vacuum seal. I'm going to recap this here without contaminating it, and I'm just going to mix the cloxacillin in my hands here. Just roll it back and forth until it's properly mixed and there's no sediment of medication. I also had noted before that the cloxacillin had not expired, so it's safe to continue to use. So now I can go ahead and draw out the amount of medication I need. So I just reconstituted for 2 grams, which is in here. I only need 1 gram according to my MAR. The final volume of 2 gram reconstituted is 8 milliliters. I need half of that, so I'll draw out 4 milliliters of medication to reach 1 gram. So again, I'm going to draw out 4 milliliters of air. I'm actually going to swab the top of the vial again in case I contaminated it in the process here. 30 seconds, let dry for 15, and go ahead and inject 4 ml of air and draw out 4 ml of medication. And there's actually no bubbles.
And then carefully open my set. Make sure it's closed.
So I'm just recalibrating to 4 here. Draw it a little more. There you go, perfect.
My Minibag.
4 milliliters of medication. Perfect. And I'm going to recap.
And then connect my tubing. So I will hang this up for now.
And now I'm just going to do my second check before I inject the medication into the Minibag here. So again, I need cloxacillin. This is cloxacillin. I have cloxacillin, and there's cloxacillin on my PDM. This is for Dora Dabney, correct patient, correct med. I need 1 gram. I have, I see here that reconstituted 1 gram is final volume of 4 milliliters. I reconstituted for 2. I had 8 milliliters and drew out 4 milliliters, so correct dose. It should be given intravenously. This is meant for IV use. I'll be injecting it into a Minibag, adding it to the secondary, and it should be given every 6 hours. It hasn't been administered yet today, and it's scheduled for now, and the time is now, so correct frequency as well. So now I can go ahead and inject the medication into the Minibag here. So again, clean for 30, let dry for 15, and without contaminating sterility, inject here and go ahead and inject the medication and draw that out. I won't be needing this anymore, so I can put this back. Now I can go ahead and create my med label. So again, this is cloxacillin for Dora Dabney. I have 1 gram. The volume is 4 milliliters of medication. The diluent amount is 100 milliliters. The concentration is 4 milliliters of medication per 100 milliliters. The date is March 2nd, 2021 at 12 o'clock. And I am TP UMSN3. So just take a peek there. So I'll do that. I had 2 here. So I'm just going to put the cloxacillin back in the med bin there. I'm going to attach this. And before I go, I'm just going to mix the bag here. Just shake it back and forth, make sure there's no sediment and it's properly mixed. Again, I noted that integrity of the bag hasn't been breached, so sterility is fine within this bag, so I can continue to use this bag. Should have done this prior to this, but I'm doing it now. So now I can go ahead and bring everything to the bedside. So I'll need my Minibag, I will need my secondary kit, and some alcohol swabs, and I'm good to go to the bedside. So I go to the bedside, knock on the door, wash my hands as I walk in, do a little safety check, introduce myself, say hi, my name is Tom, I'm going to be your nurse today, and then I go over to the patient and I ask the patient to state their name. So they say their name is Dora Dabney, and I see here her name is Dora Dabney. Dora Dabney, correct patient, ask them for their date of birth, October 3rd, 1996, which they say, and it's stated here and here, so correct patient. Ask if they have any allergies. They say yes, morphine, and I see here they have a morphine bracelet, and that correlates with the MAR here. So now I'm just going to educate the patient. So Dory, today I have cloxacillin for you. It's an antibiotic that will be used to treat your infection, your cellulitis on your left arm. You can expect nausea and diarrhea. Do you reject this medication? They say no. Ask if they have any questions. They say no, they're good to go. So I can go ahead and proceed. So now I'm just going to assess the primary infusion here. I see that it's running perfectly. It's set at the rate that's listed on the MAR. There's no occlusions. Everything looks good here. There's no signs of phlebitis or inflammation here. Ask if they have any pain. and they say no, there's no pain, and it's not occluded, it's patent, so I can continue to use this IV site. So now I can proceed. I'm going to do my third check. So again, I need cloxacillin. I have cloxacillin. This is for Dory-Dabney, and I just confirmed that this is Dory-Dabney, so correct patient. I need 1 gram. I have 1 gram here, so correct dose. It should be given intravenously. I'm going to hook this up to the IV. Sorry, a route. Should be given every 6 hours. Hasn't been given yet today, and it's scheduled for now, so correct time and frequency. So now I can go ahead and set up my tubing here. So I'm going to perform hand hygiene. And normally with these, actually I'm going to drop the primary here, just lower it. And perform hand hygiene. And now usually these spears have a cap on them, but they don't right now. So I take the cap off, maintaining sterility. Put this upside down here. And just spear the bag here. Perfect. And make sure that it is, the roller clamp is closed here, and just prime the chamber just a little bit. And now I can bring this over here. I'm going to be using a port on the IV tubing here that's above the Baxter pump, because it's going to be regulated by the pump here. So I'm going to swab the port here for 30 seconds, let dry for 15, and without contaminating or breaching sterility, I'm going to add this here. So now it's connected. I'm just going to open the clamp here and let the tubing back prime here. So let some IV medication into the mini bag, and I see that all the air is out and there's been enough IV fluid in here. So now I can go ahead and hang the IV. So now I can set the rate of the secondary. So I go here. The volume to be infused is 104 milliliters because it's a 100 milliliter bag. I added 4 milliliters of medication, so the total is 104. And then time, it should take an hour. And rate, I'm going to set as, it can be administered over from 30 to 60 minutes. I'm going to choose 60 minutes because the patient has not received this medication before, and I'm just going to monitor the reaction to their medication over time while it's being infused slowly. So 104 milliliters per hour, call back, no, and I can start, confirm, secondary, and start. So now it's started, so now I'm going to just make sure there's a few drips. Actually, unclamp this, I forgot to unclamp this, and make sure everything else is, there's no clamps or occlusions downstream. And I keep in mind I watch for the 3 drips here, and there is. So perfect. And now I ask the patient if they have any questions. They don't. I'm just going to assess the IV site right away, and there's no signs of irritation already. So I'll inform them. I'll be back shortly to just monitor the reaction to their medication. And also, once the medication has been fully infused, I will be back to make sure that the primary has started, and I will flush the secondary line with 15 cc's of medications of normal saline. And yeah, so I ask if they have any questions. They don't. I do a safety check as I leave, make sure they have their call bell, their bed's at their lowest setting, and I'm just going to document here. I'm going to sign my initials and the time I administered this medication, and I'm good to go.